Hi, I'm Ben Munson, editor at Medical Design and Development, and I'm speaking today with Katie Brinkman, who recently joined Hohenstein Medical as Biocompatibility Program Manager. So, how did you get your start working in medical safety, biocompatibility, toxicology, and regulatory compliance?
So it was actually a very lucky situation for me. I started out earning my bachelor's of science in biology from Mississippi University for Women. From there, I worked for about a decade in academic research at Houston Methodist Research Institute. And then I got my first step into industry in a quality assurance role. As it turns out, this combination of academic research experience combined with some industry experience is the perfect fit to enter into biocompatibility. And so I was recruited into a biocompatibility analyst role at Ethicon Endosurgery. So I got my start there at Ethicon Endosurgery. It's a Johnson & Johnson med tech company, and I'm just so fortunate because it was an extremely strong foundation to build biocompatibility experience and knowledge. And of course, once I got the experience with biocompatibility and I understood kind of the investigative nature of the field, as well as the interdisciplinary nature, I just absolutely fell in love with biocompatibility. So once I got into it, my passion was ignited, and I've just been going forward since. So I worked after Ethicon, I worked at Abbott, NAMSA, and Cook Medical as a scientist or subject matter expert.
It's an interesting field. I'm wondering how have recent medical device trends kind of changed the way manufacturers need to approach biocompatibility plans? I'm thinking about like 3D printing, robotics, that type of thing.
Definitely. So these new kind of technologies have definitely influenced the field. In terms of 3D printing, I would say you want to pay more attention to the manufacturing process and the manufacturing equipment used to 3D print your device. The reason is because the base polymers that are used for 3D printing medical devices are typically very well known and frequently used within medical devices. But the nature of the 3D printing process can introduce unknowns, like unknown hazards that may need to be mitigated through additional testing. In terms of robotics, that has been very interesting, and you definitely want to think very carefully about your sample preparation when you're working with robotic devices. For example, if you have electronic components in your device and they are hermetically sealed, you want to make sure that you're not extracting or including those in your biocompatibility tests.
Yeah, I'm interested in what you do at Hohenstein, and I wanted to talk to you about kind of like storytelling aspects of your job, and why is it so important to kind of boil medical device data down to sort of easier to digest stories when preparing regulatory submissions?
Absolutely. So that is a great question. So one of the biggest challenges right now in biocompatibility is that you have a mountain of data and evidence that you need to provide to a regulator to fully explain your biocompatibility evaluation. By focusing on storytelling within your biocompatibility report, you'll help to tell the story clearly and in a way that is easy to read for anyone. So biocompatibility reports are read and reviewed by all different types of people. They may have experience with your device, they may not. So kind of just putting that emphasis on making sure that you're telling a story as much as you are providing the objective evidence really goes a long way in making your biocompatibility evaluation clear and understandable.
Hmm. Yeah, the regulatory environment has changed a lot the last few years or so. And I'm wondering, how can manufacturers sort of best ensure that their medical device submissions will connect with regulators?
That's another great question. Storytelling, of course, is going to really help you connect with your regulator. Um, I guess just to expand upon that, when you're telling your story and when you're providing your objective evidence to support biocompatibility of your medical device, you want to make sure that the information you're providing feels transparent, that it's well organized, and that it is grounded in real world and clinical use. So manufacturers who connect well with regulators typically are following those three principles.
Mm-hmm.
Um,
Are there any major don'ts in terms of regulatory submissions?
Yeah, so, oh man, I might be beating a dead horse here, but I would definitely say make sure you're not data vomiting or data dumping. I have seen cases where the data and the evidence you need, you already have it, for example, in your performance testing. And I've seen people just kind of copy paste that into a biocompatibility report, and that's going to work against you. What you want to do when you already have the data in a different kind of branch of your medical device development group is summarize that data and cross-reference the lengthy report. You don't want to include all of that data because it's really easy to overwhelm your reviewer with all of that information. And also, summarizing the data will allow you to draw the conclusions, like draw the line between that performance data and your biocompatibility conclusions so that your message is easy to follow.
Okay, great. This has been really helpful. Thank you so much for your time.
Oh, yes, thank you. Thank you so much for having me on. I love talking about biocompatibility. Feel free to reach out anytime if you're hitting a wall in biocompatibility. I'd love to solve the problem together.
All right, thank you.